In this video by Deck Plate we will be discussing thoracolumbar spine conditions, some of the most common thoracolumbar spine conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Various back, thoracolumbar spine conditions veterans may suffer during military service. Thoracolumbar spine conditions refer to issues that affect the lumbar and thoracic segments of the spine. Military responsibilities, often involving heavy lifting, intense physical training, combat situations, and exposure to other hazardous conditions, can subject the spine to substantial stress, making back injuries a common condition among veterans. Degenerative arthritis or osteoarthritis. Degenerative arthritis is a term synonymous with osteoarthritis, a chronic disorder that damages the cartilage and tissues surrounding a joint. It is sometimes called degenerative joint disease or wear and tear arthritis. Causes of degenerative arthritis. People develop degenerative arthritis when the joint cartilage between bones becomes damaged or breaks down. Often, the body activates a repair mechanism to attempt to remedy this damage. As part of this, bone spurs, or osteophytes, may grow within the joint at the end of the bone. These can then cause friction within the joint and lead to pain when the person uses it. Long-term effects of degenerative arthritis. Osteoarthritis is a degenerative disease that worsens over time, often resulting in chronic pain. Joint pain and stiffness can become severe enough to make daily tasks difficult. Depression and sleep disturbances can result from the pain and disability of osteoarthritis. Diagnosis of degenerative arthritis. There is no single test to confirm the diagnosis of degenerative arthritis. Instead, doctors will ask a series of questions about the person's medical history, such as when the pain began and whether they have sustained any injuries to the affected joint or joints. They may also want to know when the pain occurs and what, if anything, makes it worse. In addition, the doctor can use X-rays to check for bone spurs or other types of bone damage. They may also take samples of fluid from the joints to rule out infection or gout and run blood tests to exclude other possible causes. Degenerative disc disease. Other than intervertebral disc syndrome, degenerative disc disease isn't actually a disease, but rather a condition in which a damaged disc causes pain. This pain can range from nagging to disabling. Causes of degenerative disc disease. Several factors can cause discs to degenerate, including age. Specific factors include the drying out of the disc. When we are born, the disc is about 80% water. As we age, the disc dries out and doesn't absorb shocks as well. Daily activities and sports, which cause tears in the outer core of the disc. By age 60, most people have some degree of disc degeneration. Not everyone at that age has back pain, however. Injuries, which can cause swelling, soreness, and instability. This can result in low back pain. Diagnosis of degenerative disc disease. A diagnosis is based on a medical history and a physical examination, as well as the symptoms and the circumstances where the pain started. Magnetic resonance imaging can show damage to discs, but it alone cannot confirm degenerative disc disease. Lumbosacral strain. Lumbosacral strain is a medical term for an injury that causes low back pain. The lumbosacral area, low back, is between the bottom of the rib cage and the top of the buttocks. A strain is tearing of muscles and tendons. These tears can be very small but still cause pain. Causes of lumbosacral strain. Muscles and tendons connected to the spine can be strained in a number of ways. Sitting or standing in the same position for long periods of time. This can harm the low back. Over time, poor posture can make low back pain more likely. Moving the muscles and tendons past their usual range of motion. This can cause a sudden injury. This can happen when you twist, bend over, or lift something heavy. Not using correct technique for sports or tasks like lifting can make back injury more likely. Accidents or falls. Long-term effects of lumbosacral strain. If the cause of the pain is not addressed, symptoms may return or get worse. Follow your healthcare provider's instructions on lifestyle changes and treating your back. Diagnosis of lumbosacral strain. Diagnostic testing is usually not necessary unless pain has lasted for more than 6 weeks and has not improved as expected following physical therapy. It is important to rule out underlying causes, such as an undetected disc injury. If symptoms are persistent for longer than 6 weeks and physical therapy has not improved the condition, the following tests may be ordered by a doctor. X-ray. An X-ray produces a picture of a part of the body and can show the structure of the vertebrae and the outline of the joints. X-rays of the spine are used to search for other potential causes of pain, i.e. infections, fractures, etc. Magnetic resonance imaging, MRI, a diagnostic test that produces three-dimensional images of body structures using powerful magnets and computer technology, can show the spinal cord, nerve roots and surrounding areas as well as enlargement, degeneration and tumors. Intervertebral disc syndrome. Intervertebral disc disease is a common condition characterized by the breakdown, degeneration, of one or more of the discs that separate the bones of the spine, vertebrae, causing pain in the back or neck and frequently in the legs and arms. The intervertebral discs provide cushioning between vertebrae and absorb pressure put on the spine. While the discs in the lower, lumbar, region of the spine are most often affected in intervertebral disc disease, any part of the spine can have disc degeneration. Depending on the location of the affected disc or discs, intervertebral disc disease can cause periodic or chronic pain in the back or neck. Pain is often worse when sitting, bending, twisting, or lifting objects. Causes of intervertebral disc syndrome. Intervertebral disc disease results from a combination of genetic and environmental factors. Some of these factors have been identified, but many remain unknown. Researchers have identified variations in several genes that may influence the risk of developing intervertebral disc disease. The most commonly associated genes provide instructions for producing proteins called collagens. Collagens are a family of proteins that strengthen and support connective tissues, such as skin, bone, cartilage, tendons, and ligaments. Collagens form a network of fibers that create structure and stability within the intervertebral discs. Specific variations in several collagen genes seem to affect the risk of developing intervertebral disc disease by impairing the ability of collagens to interact with each other, decreasing the stability of the disc and leading to its degeneration. Normal variations in genes related to the body's immune function are also associated with an increased risk of developing intervertebral disc disease. These genes play a role in triggering an immune response when the body detects a foreign invader such as a virus. It is thought that these gene variants can lead to an immune response that results in inflammation and water loss, dehydration, of the discs, which causes their degeneration. Diagnosis of intervertebral disc syndrome. To diagnose degenerative disc disease, your healthcare provider may start by asking you about your symptoms. Questions may include: 1. When does the pain start? 2. Where do you feel pain? 3. What activities cause the most pain? 4. What activities decrease the pain? 5. Did you have an injury or accident that led to pain? 6. Do you have other symptoms, such as tingling or numbness? 7. How far can you walk? Your healthcare provider may use imaging scans such as X-ray, CT, or MRI. These tests can show your healthcare provider the state and alignment of your discs. Your provider may also conduct a physical exam to check your nerve function. Your provider may use a reflex hammer to check your reactions. Poor or no reaction could mean you have damaged or compressed nerves. Pain levels. Your provider may touch or press on specific areas of your back to measure your pain levels. Strength, muscle weakness or shrinking, atrophy, could mean you have nerve damage or degenerated discs. Sacroiliac injury. The sacroiliac joints are the joints where the lower part of the spine, sacrum, connects to the pelvis. There are 2 sacroiliac joints, one on each side, with ligaments in each joint that hold the bones together. Sacroiliac joint pain can be difficult to diagnose as other conditions can cause similar symptoms. Sacroiliac joint pain is most commonly felt in the low back and buttock but can also be referred into the thigh and leg. If numbness and tingling or weakness is present, an alternative diagnosis should be considered. Sacroiliac pain can be aggravated with prolonged sitting or standing, standing on one leg, stair climbing, going from sit to stand, and with running. Causes of sacroiliac injury. Potential causes of sacroiliac pain include arthritis, traumatic injury, pregnancy and postpartum, systemic inflammatory conditions, and infection. Other potential contributors include spinal scoliosis, leg length discrepancy, and previous lumbar spine fusion. Sometimes, there is no clear cause for sacroiliac pain. Diagnosis of sacroiliac injury. The diagnosis of sacroiliac pain starts with a careful history and physical examination, which helps to distinguish sacroiliac pain from other potential etiologies. Imaging is often recommended, starting with plain radiographs, X-rays. Sometimes your provider will recommend more advanced imaging, including a CT scan or MRI. If the diagnosis is not clear, a diagnostic, anesthetic, injection into the sacroiliac joint can provide valuable diagnostic information. Spinal fusion. Spinal fusion is surgery to connect two or more bones in any part of the spine. Connecting them prevents movement between them. Preventing movement helps to prevent pain. During spinal fusion, a surgeon places bone or a bone-like material in the space between two spinal bones. Metal plates, screws, or rods might hold the bones together. They then can fuse and heal as one bone. Why spinal fusion is done? Spinal fusion connects two or more bones in the spine to make it more stable, correct a problem, or reduce pain. Spinal fusion can be used to reshape the spine. Spinal fusion can help correct problems with the way the spine is formed. An example is when the spine curves sideways, also known as scoliosis. Spinal weakness or instability. Too much motion between two spinal bones can make the spine unstable. This is a common side effect of severe arthritis in the spine. Spinal fusion can make the spine more stable. Damaged disc. Spinal fusion might be used to stabilize the spine after a damaged disc is removed. Results of spinal fusion. Spinal fusion typically works for fixing broken bones, reshaping the spine, or making the spine more stable. But study results are mixed when the cause of the back or neck pain is unclear. Spinal fusion often works no better than non-surgical treatments for back pain with a cause that's not clear. Even when spinal fusion relieves symptoms, it doesn't prevent future back pain. Arthritis causes much of back pain. Surgery doesn't cure arthritis. Having a spine that doesn't move in places puts more strain on the areas around the fused part. As a result, those areas of the spine might break down faster. Then the spine might need more surgery in the future. Spinal stenosis. Spinal stenosis happens when the space inside the backbone is too small. This can put pressure on the spinal cord and nerves that travel through the spine. Spinal stenosis occurs most often in the lower back and the neck. Causes of spinal stenosis. Spinal bones are stacked in a column from the skull to the tailbone. They protect the spinal cord, which runs through an opening called the spinal canal. Some people are born with a small spinal canal, but most spinal stenosis occurs when something happens to reduce the amount of open space within the spine. Causes of spinal stenosis include bone spurs. Wear and tear damage from arthritis can cause extra bone to grow on the spine. These are called bone spurs. They can push into the spinal canal. Paget's disease also can cause extra bone to grow on the spine. Herniated discs. Discs are the soft cushions that act as shock absorbers between your spinal bones. If part of the disc's soft inner material leaks out, it can press on the spinal cord or nerves. Thick ligaments. The strong cords that help hold the bones of your spine together can become stiff and thick over time. Thick ligaments can push into the spinal canal. Tumors. Rarely, tumors can form inside the spinal canal. Spinal injuries. Car accidents and other trauma can cause spinal bones to break or move out of place. Swelling of nearby tissue right after back surgery also can put pressure on the spinal cord or nerves. Long-term effects of spinal stenosis. In severe cases, spinal stenosis can cause a loss of bladder or bowel control, incontinence. It can also cause sexual dysfunction due to nerve issues, like erectile dysfunction or anorgasmia. It's very rare, but extreme cases of spinal stenosis can cause partial or complete leg paralysis. Diagnosis of spinal stenosis. Your healthcare provider may ask about your symptoms and medical history. You may have a physical exam. You also may need an imaging test to help find the problem. Imaging tests. These tests may include X-rays. An X-ray of the back can show bone changes that may be making the space within the spinal canal smaller. Each X-ray involves a small dose of radiation. Magnetic resonance imaging, an MRI, uses a powerful magnet and radio waves to produce detailed images of hard and soft tissue. The test can detect damage to the discs and ligaments. It also can show tumors that may be present. Computerized tomography, CT. If you can't have an MRI, you may need a CT scan. This test combines X-ray images taken from many different angles. In a CT myelogram, a contrast dye is injected to outline the spinal cord and nerves. This can show herniated discs, bone spurs, and tumors. Ankylosing spondylitis. Ankylosing spondylitis, also known as axial spondyloarthritis, is an inflammatory disease that, over time, can cause some of the bones in the spine, called vertebrae, to fuse. This fusing makes the spine less flexible and can result in a hunched posture. If ribs are affected, it can be difficult to breathe deeply. Causes of ankylosing spondylitis. Ankylosing spondylitis has no known specific cause, though genetic factors seem to be involved. In particular, people who have a gene called HLA-B27 are at a greatly increased risk of developing ankylosing spondylitis. However, only some people with the gene develop the condition. Long-term effects of ankylosing spondylitis. In severe ankylosing spondylitis, new bone forms as part of the body's attempt to heal. This new bone gradually bridges the gap between vertebrae and eventually fuses sections of vertebrae. Those parts of the spine become stiff and inflexible. Fusion also can stiffen the rib cage, restricting lung capacity and function. Other complications might include eye inflammation, called uveitis. One of the most common complications of ankylosing spondylitis, uveitis can cause rapid onset eye pain, sensitivity to light, and blurred vision. See your healthcare provider right away if you develop these symptoms. Compression fractures. Some people's bones weaken during the early stages of ankylosing spondylitis. Weakened vertebrae can crumple, increasing the severity of a stooped posture. Vertebral fractures can put pressure on and possibly injure the spinal cord and the nerves that pass through the spine. Heart problems. Ankylosing spondylitis can cause problems with the aorta, the largest artery in the body. The inflamed aorta can enlarge to the point that it distorts the shape of the aortic valve in the heart, which impairs its function. The inflammation associated with ankylosing spondylitis increases the risk of heart disease in general. Diagnosis of ankylosing spondylitis. During the physical exam, your healthcare provider might ask you to bend in different directions to test the range of motion in your spine. Your provider might try to reproduce your pain by pressing on specific portions of your pelvis or by moving your legs into a particular position. You also may be asked to take a deep breath to see if you have difficulty expanding your chest. Imaging tests. X-rays allow doctors to check for changes in joints and bones, also called radiographic axial spondyloarthritis, though the visible signs of ankylosing spondylitis, also called axial spondyloarthritis, might not be evident early in the disease. Magnetic resonance imaging, MRI, uses radio waves in a strong magnetic field to provide more detailed images of bones and soft tissues. MRI scans can reveal evidence of non-radiographic axial spondyloarthritis earlier in the disease process, but they are much more expensive. Lab tests. There are no specific lab tests to identify ankylosing spondylitis. Certain blood tests can check for markers of inflammation, but many different health problems can cause inflammation. Blood can be tested for the HLA-B27 gene. But many people who have the gene don't have ankylosing spondylitis, and people can have the disease without having the HLA-B27 gene. If you were discharged veteran from U.S. military and looking for the compensation you can get for the thoracolumbar spine conditions, please check out our other video on thoracolumbar spine conditions with compensation rating. Thank you for watching our video. Please don't forget to subscribe and like our videos.